Let's talk about nervous patients and sedation dentistry. I work on a lot of people that are really nervous. I've gotten pretty good at it over the years. I'm not perfect by any means, but I've gotten good at working on people that are nervous, calming them down, making them feel comfortable, going slow if need be, just going at their pace. One of the biggest and best tools in my toolbox, though, is something that is called sedation dentistry. It's done with a pill that we give the person an hour before we start. On an empty stomach, they'll start to feel kind of sleepy in about that hour. Then we get them back, hook our monitors up. They're monitored all the time, and there's always someone in the room with that person. And we call this conscious sedation. It's not IV sedation done, with an injection through your arm. This is conscious sedation done with an oral medication. Conscious because the person's never really all the way asleep. It shouldn't even be called sleep dentistry, even though some people do. I want my patients to be awake enough to respond to me. If I ask them, hey, does your bite feel okay? I can wake them up enough for them to tell me. It's safer that way. But I've not seen anybody in the 15 years I've been doing this that wasn't better off being more calm. My joke is for some of them, of course I'm joking, I say, okay, I'm going to give you this pill. Now if you don't want to take it, I'm going to take it, because at least one of us needs to be calm while we're working on you. I don't really do that, by the way. I have a few questions about it. People ask, will they be completely asleep? As I've already said, no, they won't be. They'll be slightly awake. Most of them don't remember anything, which is really the greatest thing about it. I've had people treated in the morning. They seem fully awake at 11 o'clock or noon by the time we send them home. Really not remember anything of the whole day, which is fine with me. We can do usually longer appointments that way, get more done if that's what they want to have done. It's for people that are nervous. I've got a couple guys, one guy we saw last week, and he's not really a nervous patient, but he's got a really sensitive gag reflex. And we've got to do 2 crowns on him, caps you might call them, on back teeth. And we both agreed after trying without it, say, Dave, why don't we do this sedated? Your wife will have to bring you and take you home, but you'll be comfortable, I'll be comfortable, I can do a much better job if you're sedated. So he's not a nervous patient at all, he just has this hyperactive gag reflex. But I've seen so many people that being sedated really helps them. Let me see if I've got any more questions about it. It's very safe. Basically Halcyon is the pill I use, and it just makes people sleepy. It stays in the system about 2 to 4 hours, but the amnesiac effect usually lasts the rest of the day. They just don't remember what happened that morning. Benefits,